Okay, so this is my video on the blood-brain barrier and multiple sclerosis. I like to say this was a very hard video for me to make. I didn't really know anything at all about the blood-brain barrier before I started kind of doing some research on this. And I have all my sources linked in here so y'all can look at them. Just going to be, I'll have the titles of all the different publications I used and research studies I looked at. I'm not a doctor. This is just me taking a look at it and trying to figure it out best. So basically, what is the blood-brain barrier? The blood-brain barrier functions to protect neurons from harmful substances and maintain a stable brain environment and control the nutrients that enter the brain and prevent infections and toxins from entering the brain. There are some areas without a typical blood-brain barrier. We don't really have to get into that too much, but basically there's four structural components of the blood-brain barrier. There's the tight junction cells, the endothelial cells, which line the blood vessels. This is the blood capillary. Around that is the basement membrane. There's the pericytes and the astrocytes, right? So the endothelial cells form a wall around the capillaries in the brain joined together by tight junctions, which prevent free patches of substances. Unlike normal capillaries, they do not contain pores. Tight junctions seal endothelial cells together and restrict the movement of water-insoluble substances between cells. Basement membrane, thin extracellular layer surrounding endothelial cells, helps provide structural support and filtration. Pericytes embedded with basement membrane. These regulate blood flow, capillary stability, and blood-brain barrier maintenance and repair. Astrocytes induce and maintain the blood-brain barrier properties and help regulate ions and water balance. So healthy blood-brain barrier should allow oxygen, carbon dioxide, lipid-soluble substances, and alcohol and anesthetics to easily cross the blood-brain barrier. It's going to cross, and some substances are going to cross via transporters. That would be glucose, amino acids, and some ions. Large proteins, toxins, and many drugs and bacteria will be blocked from passing this blood-brain barrier. So the difference between the blood-spinal cord barrier and the blood-brain barrier. So basically, the spinal cord barrier is kind of like a weaker barrier than the blood-brain barrier. It has weaker tight junctions, less complex tight junction proteins than the blood-brain barriers, allows somewhat greater movement of molecules across the barrier. Higher transcytosis. Endothelial cells in the spinal cord transport more substances through the cell than those in the brains. Different pericyte and astrocyte interactions. The blood-spinal cord barrier has somewhat different support cell signaling, contributing to its increased permeability. So basically, it's structurally the same. It's however more permeable. And the blood-brain barrier is a dysfunction is a prerequisite, at least in multiple sclerosis attacks, right? And this has been at least theorized for a while. And there was a 1986 theory on MS, and it had 4 elements required in order to develop multiple sclerosis, which would be genetic susceptibility, environmental, and probably immune-mediated events, alteration of the blood-brain barrier function, and myoclonic plaque forming capability in the CNS. So that's basically lesion development. And there are some studies on the blood-brain barrier dysfunction in multiple sclerosis, and it says that the possible causes for a blood-brain barrier dysfunction in MS, there's some genetic polymorphisms of certain genes that may influence blood-brain barrier permeability of immune cells, allowing more pro-inflammatory immune cells to cross into the central nervous system. Those would be your white blood cells, which cause the lesions within your brain. And then they said that potentially diet, vitamin D, and the gut microbiome could have an effect. They found a mice model showed complex fiber-enriched diets promote anti-inflammatory and AEE protective short-chain fatty acids by the gut microbiome. High amounts of short-chain fatty acids suggest that the importance of a healthy gut on the microbiome for blood-brain barrier function. Conversely, obesity, diets high in saturated fats and sugar have been found to be down to the opposite effect, increasing blood-brain barrier dysfunction. Vitamin D also has a crucial role in protecting the blood-brain barrier function. They talk about the Epstein-Barr virus, how it mimics proteins in the CNS that are essential to maintaining the blood-brain barrier integrity. That may be why Epstein-Barr virus is so linked to multiple sclerosis. If the immune system were to attack those cells through molecular mimicry, it could cause direct damage to the blood-brain barrier. Additionally, prime T cells could enter further into the central nervous system in more systematic inflammation. They also bring up some other factors: smoking, night shifts, aging, traumatic brain injury. I used to work night shifts. I worked at a bar, so maybe that's potentially factor that caused things to happen. But what I found really interesting is that pretty much all these that they bring up are also things that are contribute to your risk factor to multiple sclerosis. So I don't know if they just didn't look at anything else that could potentially be a risk factor, blood-brain barrier dysfunction, or basically anything that causes blood-brain barrier dysfunction also causes you to have risks in multiple sclerosis. So consequences of disrupted blood-brain barrier. This would be accumulations of toxic molecules, fibrinogen, a protein produced by your liver that circulates in your blood, an essential precursoror to fibrin, which helps your blood clot during an injury. However, the blood-brain barrier becomes compromised. Fibrinogen can leak into brain tissue. Once in the CNS, fibrinogen can convert to fibrin, causing an immune response, neuroinflammation, and damage brain tissue. Patients with RRMS often show signs of fibrin and fibrinogen deposition, likely occurring after blood-brain barrier breakdown. This could potentially contribute to pathological mechanisms in progressive forms of multiple sclerosis. And then they also bring up iron. Pathological iron deposits in the brains of people with MS is often linked to death of iron-enriched oligodendrocyte destruction and their myelin sheaths. The article I linked above before, you can take a look at it, but they argue that it's possible that blood-brain barrier dysfunction could allow blood cells into the central nervous system, where the blood cells break down or release their iron contact directly into the central nervous system. I don't know if I necessarily like. I thought that was kind of weird. Because you would have to have like a very open blood-brain barrier to allow that to happen. But that's just what this article argued for. And excessive iron accumulation is linked to ferroptosis, an iron-dependent form of programmed self-death, which is linked to iron overload. So basically, when your cells come into contact with large amounts of iron, it causes them to die. And that's kind of not good when your brain's trying to heal itself from damaged lesions. So, yeah, that's unfortunate. And so there's studies on perivascular enhancement patterns. So basically, there's this perivascular space, which is a fluid-filled channel that surrounds small blood vessels that enter the brain. It's kind of just like the area between the blood-brain barrier and the blood vessel itself. MRI findings highlight inflammation around small blood vessels in the brain. On the MRIs of MS patients reflect the blood-brain barrier dysfunction at the level of small blood vessels, allowing contrast agents used on MRIs to leak into perivascular compartments. So they can basically see see the contrast agent within these perivascular spaces within your brain, which points to blood-brain barrier dysfunction, and it's one of the ways they kind of it's one of the things they look for on MRIs of people they think might have MS. And as polyvenular species in multiple sclerosis, a sign of perivascular inflammation in primary demyelination, perivenular disruption of MS plaques. Lesions in MS patients typically form around small veins within the brain, a cornerstone in MS pathology, and this causes a phenomenon known as Dawson's fingers, which was an observation made by James Dawson in the 1960s, who noticed lesions often form around veins. Periventricular lesions radiate along these large collecting veins. Perivenular inflammation is understood to be a primary driver of blood-brain barrier disruption, myelin breakdown, and new lesion formation. So basically, these new lesions, the lesions typically form around small veins within the brain and the central nerve and the spine, and these lesions in the brain kind of look almost like fingers because they follow the veins. And there is a connection to leaky gut and the blood-brain barrier. The gut barrier and the blood-brain barrier utilize tight junction proteins to regulate permeability. Now, tight junction proteins within the gut and the blood-brain barrier are not exactly the same, but they are very similar in their proteins. Dysbiosis and inflammation of the gut can cause breakdown of tight junction proteins in the gut and a corresponding breakdown in the blood-brain barrier. There's protein similarity would be through claudins, foundational structural component both in the gut barrier and the blood-brain barrier. Claudin 5 is the primary barrier-forming protein in the blood-brain barrier. The gut uses multiple claudins, claudin 1, 3, and 5, to manage permeability. Occludin regulates pericellular electrical resistance and stability across both endothelial blood-brain barrier and epithelial gut barrier layers. Zonulin occludins, cytoplasmic scaffolding proteins that anchor claudins and occludins directly to the cells, acting as a cytoskeleton. It is theorized that the breakdown of the gut barrier could cause your immune cells to develop an immunity towards tight junction molecules in the gut, potentially causing immune response and subsequent breakdown of the blood-brain barrier. This theory could, however, work the other way. A breakdown in the blood-brain barrier could then cause a breakdown of the tight junction proteins in the gut. So it's like, what's happening first? But I would recommend you to watch this video by Dr. Peter Kahn if you want to understand more about this. He has a really good video, and it kind of really helped me like understand the whole thing. And there are some there's some research now being done on repairing the blood-brain barrier. Blood-brain barrier repair and integrity seems to have long been ignored within not just MS treatment, but other diseases linked to blood-brain barrier dysfunction. This would include Alzheimer's disease, traumatic brain injury, and other diseases. Despite blood-brain barrier dysfunction being a hallmark of these diseases, there's little research has been done into the repair of this dysfunction. Improving blood-brain barrier function could potentially prove as a worthwhile therapeutic target, not just for multiple sclerosis, but especially Alzheimer's and all these other neurodegenerative diseases. And there is one kind of drug in the MS space that works as a repair to the blood-brain barrier. So basically, Tysabri is a monoclonal antibody designed to treat relapsing forms of multiple sclerosis and works by preventing certain immune cells from cells in the bloodstream from crossing into the blood-brain barrier. So basically, it prevents your white blood cells from passing your dysfunctional blood-brain barrier by attaching a little onto some of the proteins within the white blood cells. But ticagrelor doesn't actually fix your blood-brain barrier. It just attaches to your active white blood cells, preventing them crossing this barrier. If you want to know more about how this works, Dr. Rob Swanda has a good video on this. You should watch that. And this study, they had 3 proposed targets for fixing blood-brain barrier dysfunction, and that was managing disease risk factors through lifestyle modification, reducing stresses acting on the blood-brain barrier, targeting the stressors themselves. This would be hypertension, blood glucose, reducing inflammation before there is any damage to the blood-brain barrier, and directly targeting the mechanisms of blood-brain barrier dysfunction. The author argues the most effective strategy by combining all of these. He also goes over some potential pharmaceutical therapies they're looking at. I'm not going to go over that. You can read the article yourself. But he does mention some non-pharmacological repair strategies for the blood-brain barrier. There's high-fat and high cortisol diets damage the integrity of the blood-brain barrier, specifically in the hypothalamus. So they recommend avoiding high-fat, high-cholesterol diets. He also recommends anti-inflammatory substances like vitamin C and E, as well as flavonoids like quercetin, ginseng. He also brings up curcumin, which is in turmeric, which can help it reduce inflammation and improve blood-brain barrier function. He also brings up vitamin D, B, magnesium, omega-3s. I'll just say recommendations. So avoid any potential harms to blood-brain barrier integrity. Avoid cigarettes and tobacco products. Prioritize your sleep health. If you have sleep issues, try to see a sleep specialist. Focus on your metabolic health. Take walks after meals. Avoid sugary foods. Intermittent fasting. Exercise regularly, especially cardio-based exercise. Focus on a gut-healthy diet that focuses on easily digestible foods, low in saturated fats. Eat fermented foods and other probiotic-rich sources of food. And then there's supplementation, and I wanted to talk about this one specifically, give like a warning to people with MS. Resveratrol is often recommended for blood-brain barrier integrity and sometimes multiple sclerosis because of its anti-inflammatory properties and antioxidant properties. There have been some studies that show potential for remyelination and but positive effects in human-based models. But I would recommend avoid using it till better research has been done. There's been a research on rats that found the actual increased demyelination and disease progression within rats that were given resveratrol. Basically, what they do is they induce rats with multiple sclerosis. It's not exactly multiple sclerosis, but it's a demyelinating disease. And I think they had 15 rats on each side, one that was given resveratrol and one that was a group that was not. And the group that they gave resveratrol had worse worse ability to move in the long term. So that might be a reason to avoid it. Now, that's one study based on 30 rats. I don't know if it's generalizable, but it is something to be aware of, and you can find the study right here. Here's some vitamin recommendations. Vitamin D helps manage inflammation and has been linked to better health outcomes for patients with MS and can help prevent leaky brain through its reduction in inflammation. Try to get adequate sunlight as well as consume a vitamin D supplement. Take a vitamin D3 with K2. Vitamin D helps absorb calcium, where K2 directs this calcium absorption. So it's smart to not just get vitamin D, but also try and get some vitamin K2, as well as magnesium, which is a vital chemical in your body. It's crucial for neurotransmitters enzymes, and hormones. It can also help improve your sleep. Um, Magnesium helps turn vitamin D to its more active form. However, this will deplete the magnesium in your body. So it's crucial if you're taking vitamin D to also take vitamin or to take magnesium. Um, Omega-3 fatty acids, essential fatty acids, our body can't produce. Approximately 80% in the U.S. have population is deficient in omega-3s, and omega-3s have been found beneficial to multiple sclerosis, and they are supposed to help repair the blood-brain barrier. And then B vitamins are crucial for blood-brain barrier function. So I would honestly, this is probably the most important one. This and vitamin D. Um, B1 deficiency disrupts the blood-brain barrier, and the supplementation can help resolve that. So if you don't have enough B1 vitamins, um, you will not have a functional blood-brain barrier, and that you can get through fish, poultry, meat, leafy greens, seafood, eggs, liver, whole grains. So as long if you're eating a nutritious diet, you probably have enough, but you might want to get some B complex. And then curcumin potentially could also help due to its anti-inflammatory properties, and sulforaphane, a chemical found in many green vegetables like broccoli and Brussels sprouts, has been found to have anti-inflammatory properties. Studies have found it can help prevent the breakdown of the blood-brain barrier and improve brain function after traumatic brain injury. Make sure your sulfur supplementations contains the cofactor hydrogenase, and that actually allows your body to utilize it. You can honestly get this through your diet pretty well, through lots of leafy greens, broccoli, zucchini, cabbage, kale. Kale's really high in it. Um, yeah. I'm going to link a couple of YouTube videos down below on improving your blood-brain barrier through supplementation and natural habits. But yeah, thank you for watching.